Hello everyone, today we'll be talking about viral hepatitis. So this video is going to cover a summary of all the viruses that cause hepatitis, which is hepatitis A to A, as well as a few lab markers. So let's start with some features of viral hepatitis. So the viruses that we'll talk about will be hepatitis A, B, C, D, and E. So the virus hepatitis is an RNA virus. It is 27 nanometers and it's a picornavirus. Hepatitis B is a DNA virus. It is 42 nanometers and it's hepatinavirus. Hepatitis C is an RNA virus and it's approximately 50 nanometers and it belongs to the family Delta Viridae. Hepatitis D is an RNA virus. It's 36 nanometers with hepatitis B surface antigen code and it's a flavivirus. Hepatitis E is an RNA virus. It is 27 nanometers and it's a herpes virus. So spread of the viruses. Fecal-oral spread is hepatitis A and hepatitis A. Spread via blood or blood products is rare by hepatitis A. However, hepatitis B, C, and D are spread via blood or blood products. Vertical transmission is by hepatitis B, occasionally by hepatitis C, and it's rare by hepatitis C. Then transmission through saliva, hepatitis A, B, C. Then sexual transmission is rare by hepatitis A. However, hepatitis B is transmitted sexually. Hepatitis C is transmitted sexually, but it's rare. And hepatitis D is rare. Hepatitis E is not transmitted sexually. The incubation period of hepatitis A is short. It's about 2 to 3 weeks. Hepatitis B is long. It's about 1 to 5 months. It's long of hepatitis C, intermediate of hepatitis D, and it's short for hepatitis E. Age. It affects hepatitis A affects the young. Hepatitis B, C, D, and E affect any age. So carrier state. Hepatitis A and E have no carrier state. However, hepatitis B and C have a carrier state, and the carrier state of hepatitis C is not known. Chronic liver disease is not caused by hepatitis A or E. However, hepatitis B, C, and D cause chronic liver disease. Liver cancer, which is hepatocellular carcinoma, is not caused by hepatitis A or B. However, hepatitis B and D cause liver cancer, and hepatitis C rarely causes liver cancer. Mortality acute by hepatitis A is less than 0.5%, by hepatitis B is less than 1%, hepatitis D is less than 1%, and hepatitis E is 1 to 2%, and pregnant women is 10 to 20%. So immunization. Passive immunization. Normal immunoglobulin serum, we give it IM. For hepatitis B, we give hepatitis B immunoglobulin. Hepatitis C, D, and E have no passive immunization. Active vaccination. Active, we have got a vaccine for hepatitis A, B, E, and for C is hepatitis B virus vaccine. And there is no vaccine for hepatitis D. So this is basically similar to the previous slide. However, there is one added part here, which is the diagnosis. So diagnosis of hepatitis A is by detection of serum IgM antibodies. Hepatitis B is detection of hepatitis B surface antigen or antibody to hepatitis C, hepatitis B core antigen, or PCR for hepatitis B virus DNA. Hepatitis C is ELISA for antibody detection and PCR for hepatitis C virus RNA. Hepatitis D diagnosis is detection of IgM and IgG antibodies, hepatitis D virus RNA in serum, or hepatitis D antigen in liver biopsy. Hepatitis E diagnosis is by detection of serum IgM and IgG antibodies, PCR for hepatitis E virus RNA. So when we talk about diagnosis, we need to talk about a few surface markers of hepatitis B. So we've got hepatitis B surface antigen, hepatitis B surface antibody, hepatitis B core antigen, hepatitis B core antibody, and then we have a window period. So it's better if we understand the terms before we look at the diagnosis and when each of them are present. So hepatitis B surface antigen, this is a protein in the outer lipid envelope of hepatitis B. You can test serum for its presence. Hepatitis B vaccine is mostly made up of hepatitis B surface antigen. Anti-HBs, hepatitis B surface antibody, antibody directed against hepatitis B surface antigen. IgM early on and then later IgG. It can test serum for the presence, confers immunity to hepatitis B. Then you've got HBcAg, which is hepatitis B core antigen. Core antigen encapsulated, not detectable in serum because it's covered by the envelope. Anti-HBc, which is hepatitis B core antibody. So antibody directed against core antigen, IgM early on and then later IgG. It can test serum for presence and it does not necessarily signify immunity to hepatitis B. Then the window period. There is a short period during acute infection or vaccination when there is no hepatitis B surface antigen or anti-HBs found on serum testing. So when you're going to test the serum for HBsAg or anti-HBs, you're not going to find any of them. Both are present but they are bound together and therefore are not detectable by the test. During this period, one could accidentally misdiagnose a patient as not having hepatitis B during acute infection. Hepatitis B, E antigen and anti-HBc may be present during the window period. So this is basically a summary of what we just talked about. So let's talk about the antigen and what this signifies. So significance of viral markers in hepatitis B. So HBsAg, which is hepatitis B surface antigen. This signifies acute or chronic infection. HBeAg, this signifies acute hepatitis B and its persistence implies continued infectious state, development of chronicity. Increased severity of disease. Hepatitis B virus DNA, if you detect that, it implies viral replication, is found in serum and liver, and its level indicate response to treatment. So if the levels are low, meaning the treatment is working. However, if the levels are high, it means that the treatment hasn't been started or is not effective. Antibodies. Anti-hepatitis B surface antibodies. So this signifies immunity to hepatitis B virus or previous exposure or vaccination. Anti-HBe, this is due to seroconversion. Anti-HBc, IgM, this signifies acute hepatitis B if there is a high titer and chronic hepatitis B if it's a low titer. IgG signifies past exposure to hepatitis B. So in this case, hepatitis B surface antigen will be negative. So this is a similar diagram just explaining the same thing that I've already explained. However, the two tables here, the above one has already been explained, the lower one is the one that I'm going to talk about now. So the stage, then ALT is our liver enzyme and HBe antigen, then we've got hepatitis B virus DNA. Immune tolerant, so we've got a stage which is immune tolerant, immune active, immune surveillance, and immune escape. So immune tolerant, ALT will be normal, HBe antigen will be positive, and hepatitis B virus DNA will be high. Then immune surveillance, ALT will be normal or slightly raised, HBe antigen will be mostly negative, and hepatitis B virus DNA will be low. So that's all about hepatitis viruses as well as the serum markers. Thank you.